Happy New Year and welcome to the Great Lakes Health Radio program with your host, Francesca Messiah from Kaleida Health, manager of workforce development, which includes pipelining, developing, and getting you uh, to consider working at Kaleida Health. We want you, we need you, we want you to grow with us here at Kaleida Health. Well, who is Kaleida Health? And I know I say this every time, and I've been saying it for years, but there are still people in the community who will ask, who is Kaleida Health? Well, Kaleida Health, or Buffalo General Medical Center, which many of us know as Buffalo General, as Buff Gen. We're Millard Fillmore Suburban. We're the Oshai Children's Hospital Visiting Nursing Association, which provides nursing and medical services 24 hours a day, 7 days a week, to individuals residing in their homes in the 8 counties of Western New York. We're Gates Vascular Institute. And we're also, for about 3 years, we have a cancer division called the Great Lakes Cancer Care Collaborative. So the Great Lakes Cancer Care Collaborative provides the same oncology services as any of our local cancer facilities, as well as those located in other states or even up the road, up the thruway. Kaleida Health also has clinics located throughout Buffalo, in the south of Buffalo, the Hamburg area, north of Buffalo, in the Amherst Williamsville area. And again, we have great cardiac services. We have services for those with diabetes. We have doctors. We have hundreds of doctors. We have hundreds and thousands of nurses. And also we are affiliated with the, oh my gosh, I just forgot, not that I forgot the name of it, but I will come back to the name of our largest hospital practice. I will come back to it because it just literally popped out of my mind, and maybe Dr. Sella can help me with it, with the name of our large GPPC. Thank you, General Physician Practice, which again have hundreds of physicians located throughout Erie County in Western New York. Dr. Selleck is our speaker, our guest for today. Today's topic, Dr. Selleck, who is a hospital epidemiologist and professor of medicine and infectious diseases. Today, we'll be discussing RSV, COVID-19, and the flu. Many of us, I just finished reading an article in today's paper talking about the rise of COVID-19, although it looks different from it did in 2020, the flu, and RSV. And he's going to be discussing all three of these. Good morning, Dr. Selleck. How are you today?
Good morning, Fran. I'm good. Thanks for having me on again.
Oh, you're welcome. And I know, Dr. Selleck, this is something I think we discussed in September of 2023 about COVID. And we're like, well, we weren't quite where we were, but now with RSV and flu, I said, I had to have you on today, our first show of the year. And to get started, does COVID, and I literally just finished reading an article about 10 minutes ago in the paper, does COVID-19 remain as serious a disease as it was in 2020? And how does it differ now that we're in 2024?
Well, it's interesting, that supposedly the old Chinese proverb, may you live in interesting times. And we certainly have, with the introduction of this new virus into the human population. There have been other SARS coronaviruses, but none of them have spread the way this one has. We continue to see cases. Some of these people get hospitalized, but in general, we're not seeing what we saw back in 2020 or even into 2021 when if everybody wants to remember those images of the hospitals being overwhelmed and having to have temporary morgues and refrigerated trucks and such. We're not there now. The disease, it is not a completely harmless disease, but it is not what it was back then. So that's that's a good thing. But I just don't want people to think that this has gone away because as you say, we're seeing lots of respiratory illness right now, and I think one of the signs that COVID has gotten a little more mainstream is we're back to seeing flu and RSV circulating at their normal times of the year. So, we now have these big three respiratory viruses, and there are a whole bunch of others that we usually see, cycling through in the cold weather months here. So it's still around, though fortunately, with so many people having been, at least gotten the base vaccine and people having been infected. So we have a population that has a reasonable amount of immunity. So we're in much better shape.
And it's funny that you say that. I just took a puff of my inhaler because I've been coughing so much, and I do have asthma, and I didn't take anything, and I've not had to use my asthma inhaler probably, oh my gosh, in over a year, but all of a sudden, it just seems to have flared up. Is that possible? A little RSV that's in the air that's causing me to suddenly have to use this?
So you're talking about COVID or RSV?
I just jumped to RSV and asthma.
Okay. Yeah. RSV has been around, was described many, many decades ago. And we always thought it was primarily a disease of children. And it still is, when you look at the total number of cases, it is a disease of children. My youngest grandson doesn't live in Buffalo, but was hospitalized for a few days when he was about, I don't know, maybe 5 months old, which is kind of the time that we really see this hit. And certainly Oishei Children's Hospital here has been, very heavily impacted by RSV. Now, one of the things that we've learned is we've gotten better diagnostic tests because one of the things in the past that we either had to try to grow viruses in cells, or we had some less sensitive rapid tests like the rapid COVID test. But once we had good molecular diagnostic tests like the PCR, it turns out that we actually see a pretty good amount of RSV, especially in the older adult population, people over 60 or 65, and it becomes especially dangerous for people over the age of 75. And again, with all of these groups, if you have underlying diseases, if you have underlying chronic lung disease, asthma, if you're a smoker, if you have heart disease, these all tend to be much worse in that group of patients.
Mm-hmm. Thank you. And I'm just jumping around for the listeners. I'm jumping around a little on this interview, but back to COVID, Dr. Selleck. Do you think for those who weren't vaccinated, for those who did not have the vaccination, are there chances of getting the serious COVID disease as in 2020, now that we're in 2024, if they were not vaccinated? Are those persons still at risk of getting a bad case of COVID or not?
Okay. You remember there was a lot of very contentious debate about whether we should be using vaccines or whether we should rely on natural immunity. And when you look at natural immunity, for those of us of a certain age who remember getting a smallpox vaccine, and those of us who got measles, mumps, rubella, and chickenpox, those diseases, by the nature of the way those viruses cause disease, once you're infected, you're protected for life. It's very different with these respiratory viruses like SARS-CoV-2 that causes COVID, RSV, and influenza. You don't get that, solid lifelong immunity. Now, the reality is that if you've had any experience with these viruses, it probably modifies the disease to some degree and may give you some protection. But the reality is, along with the fact that you don't get that good lifelong immunity, these three viruses change a lot, especially COVID and even more so flu. Changes very, very regularly. Sometimes we see different flu variants come out during the flu season. So it's still, even if you've had COVID, it is still a good idea to keep up to date as the new versions of the vaccines come out. If you've had the flu at some time in the past, which most of us have, but still you need to get a flu shot every year and stay up to date. RSV, we're still learning about because this vaccine is very new, but I expect that that's going to be a vaccine that we get on some regular interval as well.
Mm-hmm. COVID and side effects. I remember, and I still speak with friends. I have a friend who drinks Diet Pepsi quite a bit because she says she still has the tiredness from COVID. And that was like several months ago when she had it, as well as another friend. How are the side effects? Have the side effects from COVID subsided? Will people with the sleeping, that feeling of sleepiness, will that eventually go away, or is it just too new to say?
Yeah, it's when we say side effects, I just want to make sure people don't accuse or don't confuse it with side effects of the vaccine, because the side effects of the vaccine are minimal. What we're talking about with COVID is so-called long COVID. That is people who, get through that first phase of illness and they just don't bounce back right away. We know that, two of the main things that we see with this is people with persistent cough and shortness of breath, and people with persistent neurologic things, being fatigued, so-called brain fog, not being able to, think clearly all the time, having, some other, kind of scattered neurologic things. And those continue to happen with COVID. They're much less likely in people who have been vaccinated, but they do continue to happen with COVID. Probably not quite as much as they did 3 years ago, 4 years ago, but they do still continue to occur.
Mm-hmm. Flu and RSV. Now, some people say that they, been home from work because they felt lousy and they didn't test positive for COVID, and they're not sure if it was the flu or RSV. Does RSV and flu have the same type of impact on the body? And if they differ, how do they differ?
Yeah. Yeah, this is one of the problems that we have. The respiratory illness that you get with COVID, flu, and RSV. There's so much overlap that it's very difficult to tell one from the other without appropriate testing. Sometimes we see someone, I've seen, patients, where there's a family member or roommate, the patient has flu and the roommate or the family member has RSV, but yet they they look so much alike, and we say, well, gee, this is someone who was together with this family member, either at home or at some other gathering, and geez, they really have to be, that's probably what they have. But there really is a lot of overlap with these. So the only way to know is to get tested. And as you pointed out, right now we have pretty good availability of, the self-administered rapid COVID test. But again, they're not quite as sensitive. They don't pick up as many cases as the more expensive PCR test. And, we don't have good, self-administered home test yet for the other viruses. So a lot of times this is a story that I get a lot is usually it's, friends, family, whatever, say, I feel really crummy, and I got some cough and I'm congested. But I've used both of the tests out of my, little, free government test box for COVID, and they're both negative. And, that's the point that I usually tell them that, you're either dealing with flu, with RSV, or maybe one of the other viruses that, sometimes cause similar kind of illness at this time of year.
Mm-hmm. And back to the home tests, I know that if they're not free, I'm not sure how much they cost in the store, but I guess I'm thinking if you take one, and I think with the home tests or in COVID, it says, is it still stay home for 5 days or quarantine for 5 days or quarantine for 10 days?
Right now, it's like with our healthcare workers and very similar in the community, we really like to have you out of circulation for the 5 days after you're diagnosed. So you start counting the day after the day you're diagnosed is day 0, and then you start counting those 5 days. And if you're better, your fever is gone, your cough is better, you can get back out in circulation, but you really should wear a high quality mask for another 5 days. That's the safest way to do this.
And that's the part they don't tell you on Google. Dr. Google will tell you to quarantine for 5 days, but they don't mention wearing a mask for another 5 days.
Yeah, that's preferred, and everybody can go to cdc.gov, and they have a huge amount of COVID resource. So, not really too hard to get the information. And a lot of times when you do a Dr. Google, the way their algorithms work, different things may show up, and sometimes you may get things that are coming from unreliable sources. So I would go to either CDC or the New York State Health Department and get more reliable info.
And just skip Dr. Google.
Yeah.
With all of these diseases, RSV, COVID-19, the flu, in your opinion, how important is rest?
Well, I think that, certainly proper sleep has been in the news quite a lot in the last few years. And I think, in general, even though a lot of us, look at sleep as wasted time, humans evolved sleeping. Most animals have evolved with, some form of sleep. Serves very important functions in terms of, kind of the housekeeping in our brains and the rest of our bodies. So I think that, you get the flu or you get COVID and you say, okay, I'm just going to keep going, keep going. I think, it's a good message that, if you slow down, it doesn't mean you have to lay in bed all day, but you dial things down a little, keep yourself hydrated, Make sure you're eating a good steady diet, and so many people, because of work and chasing after kids and all that, eating is very irregular. So I think the more of that stuff that you do on schedule, the better it is.
Mm-hmm. Should the public be concerned? Like, let's say, I'll give you an example. Like, if say you're in an office environment, you're not working from home, and every day you come in and everyone is coughing, and people are saying that they aren't, I mean, they don't have anything, and they probably don't. But should the public be concerned, even this summer, if they're on the beach or at an amusement park and people are coughing and sneezing? Because I know this goes on throughout the winter months. But should the public be concerned throughout the year with and with the thoughts of RSV, COVID, and the flu? Is that something we should be proactive in thinking about and protecting ourselves?
Yeah, I think that's a good question. Early on, we weren't, we knew that this was a respiratory virus, and most of the transmission happens at very short range, within a few feet of someone who is sick, those large droplets that come out when you cough. We weren't quite as clear about some of the other things, so we were a little more aggressive with masking recommendations and such. For the most part, if you're outdoors and you're not crowded, like if you're crowded in a line at the amusement park, or crowded at a concert or some such thing, then there is some risk there. But by and large, when you're outdoors, and especially, where Western New York is, Buffalo is one of the higher number of wind day cities in the state. In fact, I think we may actually be second to New York. So you have that good air movement. You're probably going to be okay. But again, when you start packing people close together, like I said, think of very crowded line at amusement park, or going to a ball game, or like I said, being at a concert. Then you start getting into trouble. And certainly one of the reasons that we have a defined respiratory virus illness in the northern climates that's much more distinct for us than the rest of the country, is because we're indoors more, especially once kids go back to school and they're in classrooms together with one another, as opposed to being outdoors, playing sports and doing other such things. So I think everyone has to make their own decision. This is the time of the year that these viruses spread. We're kind of at a peak of hospitalizations now. Hopefully we're at the peak that's very similar to where we were last year at this time. And when you're in that setting, I think it's perfectly reasonable for anyone who's concerned about getting infected or reinfected with COVID, anyone who has underlying medical problems, especially with their immune system, wearing a high quality mask is a great idea. And again, unlike 4 years ago when there were shortages of everything, right now you can get good masks, including KN95s, which are the KN95s, KF94. Those are the Asian versions of our N95. You can get those in the store for probably no more than a few bucks for several masks. And if you're really at risk, I think that's a good thing to do.
Yeah, I'm just gonna say, and for some of the masks, like the cloth mask, if you have one, you can still wash it. Not to use it, reuse it, and reuse it, but wash it in between. And if you see me out in the community at an event, just ask me, Francesca, do you have a mask? Because I just found some masks, and I will be continuing to carry them to our Kaleida Health job fairs. So, what do they have to do with the job? It's your health. Dr. Snyder, or sorry, Dr. Selleck, we have a few minutes remaining. I want you to share what you feel is important for us, the listeners, the community, to know about RSV, COVID, and the flu.
Yeah, I think that the key message remains that these are, even though most people do well when they get these infections, there's a percentage of people who are sick enough to make it to the hospital, and there's a smaller percentage of them who will die from these infections. So, I just want everyone to take them seriously. Keep up to date with the vaccines. The new COVID vaccine, has been reformulated to be more effective against the current variants. The flu shot gets updated every year to be in sync with the variants. And again, our RSV vaccine, this is the first year that we've had it. But I think staying up to date with the vaccines, taking care of yourself in general. If you think you're getting sicker, then making contact with your primary care doctor or getting to an urgent care center, something like that, is a very wise thing to do. And as we just discussed, if you think you're going to be at risk and you're going to be in a crowded setting, wearing a mask is a great idea. And as you pointed out, many of the people who work at desks in the hospital, and even when you go out to your grocery store or whatever, you'll see the people who the ones who are working at the service desk or the cashiers, where they're coming in close contact with a lot of people. You're starting to see more of them wear masks again on their own, which again is a good idea.
No, it is. I just have to add one quick thing. I know we're going to be ending in minutes, or not minutes, in seconds. Paxlovid. It's not for everyone. I've heard if your COVID isn't as serious. Is that true?
It's again, we're not seeing the very severe disease that we did, but we do still see people who get significantly ill from it.
Mm-hmm. Dr. Selleck, are you available if somebody wanted to have you on a virtual, give a virtual presentation, like to a block club or a school group? Are you available?
That varies by time, in terms of my other clinical responsibilities. It's a little bit difficult, for, doing very small groups, but certainly I would, I could try to, make myself available for something like this, for other groups of people. I prefer to do it remotely for the reasons that we just talked about, that, otherwise you would have a lot of people in close quarters indoors. So the chances of spreading infection would be higher. So, it would be better if we could, keep some distance between ourselves and the virus.
Right. And on that note, I just want to say, so if anyone is interested in having Dr. Selleck at one of their programs, contact me and I'll contact Dr. Selleck for you. And then I'll connect you that way. And my email address is fmessiah, MESIAH, at Kaleida Health, KALEIDAHEALTH.org. And Dr. Selleck, I want to thank you for being our first guest this 2024 season on the Great Lakes Health Radio program. Thank you for being our guest.
Thanks for having me. Happy New Year to everyone, and stay well.
Thank you. And don't leave our show. We have one more guest. Thank you, Dr. Selleck.
Bye.
And now on to part two. Again, we're an hour-long format. We've been in this new format since September of 2023. And we're just going to jump right into the program. I'm hoping that many of you who are listening at 7 this morning are still tuned in to us at 7:30. And our topic for today, we are going to be talking about an organization, a building that's been around for many years, and a program, I should say, a program, and that's the UB, and it's now called the University of Buffalo Arthur O. Eve Educational Opportunity Center. Growing up, it was known as UB EOC. So today, the reason for talking about this program, and because it offers job opportunities. I didn't know if everyone knew that EOC offers job opportunities, and they've been around in our community. We'll talk about that for at least over 50 years. Our guests for today are Lynette Towns, and Lynette Lynette. What is your title? If you could give me your title again.
Career Services Supervisor.
Career Services Supervisor at UB EOC, and then Larry Donaldson, who will be joining us shortly. And Larry is the Supervisor of Admissions. Is that Larry's title?
Yes, it is.
Yes. So, and he'll be joining us shortly. So, Lynette, what's the history of now the University of Buffalo Arthur O. Eve Educational Opportunity Center?
So the Education Opportunity Center has been in existence for approximately 50 years. It began with Arthur O. Eve, and we have 10 education opportunity centers in the state and 2 career centers. So Buffalo, we're here. We have the closest ones to us are Rochester and Syracuse. So what we do, we provide academic and vocational training to individuals in our community, in addition to preparing them for jobs. We're located at 555 Ellicott Street, so right downtown in Buffalo.
And Lynette, where were you before? Because some people may not know that EOC has moved.
And so we've been here for about 10 years, I believe. Prior to that, EOC was located at 465 Washington Street.
Okay, so and you said 50 years, so for 40 years, the first 40 years it was in that location. I just remember like Hangers was down there and all the different department stores. Mm-hmm. And what time? And I know there are classes that are held in the building, and I just want our listeners to know what time are classes held.
So we have a variety of programs. Some classes are held during the day, beginning at 9 a.m. We also offer evening classes that most of the time will begin about 4 p.m. In addition to that, some of our classes are online. So some people can kind of take them, at their own pace.
Mm-hmm. And I just want everyone to give you a visual of where the new office is. I would say, but it's on the Buffalo Niagara Medical Campus, diagonally across the street from the Trico building that is currently under construction. And there's a church a block away at the corner of that large Catholic church on Main Street that I can't think of the name of right now. But just to give individuals an idea of where the building is located. Larry has joined us. Good morning, Larry. How are you?
I'm fantastic. Good morning. How are you?
Oh, wonderful. And Larry, you're right in time, because I'm going to give you the next question. And I know there are several programs at EOC. However, what are the top 5 programs that fill up the quickest? High in demand.
That's a good question. The high demand, obviously, for the West New York community is our allied health programs. Currently,
and what's the allied? Yep.
Allied health programs are our healthcare programs. And currently we have RMA, which is Registered Medical Assistant. It's a fantastic program. If you think about what people are familiar with in the medical field, RMA will be right underneath an LPN. So you would have RN, LPN, then RMA. It's an exciting position in Western New York. And the next one after that is medical billing and coding, which is another great track in the allied health field. Medical billing and coding deals with dental offices, doctors' offices, hospitals, because when we use our physicians in whatever capacity we use them in, we all have to be billed for that. So we teach young ladies and young men how to medically bill and how to code billing for various physicians, hospitals, doctors, and dentist offices. The third is our central sterilization technician. These are hands-on people in facilities that can include doctors' offices up to hospitals where they work with instruments and they learn how to disinfect and clean instruments that are to be reused within a hospital or physician's office or a dental office setting. Those are the top three. And then we have our CDL. A couple of years ago, Lynette had a great idea, loved her leadership in that. When we have a shortage of commercial drivers in Buffalo and Western New York area, specifically, we wanted to target the audience for school bus drivers because there's still a tremendous need out there for school bus drivers. So that is one of our biggest programs as well. So what we do is we do the test prep for the permit for your CDL before anybody gets
What does CEL stand for?
Commercial driver's license.
Oh, I see. Oh, okay. Thank you.
So most of us have just a standard driver's license where we drive a car. We might have passengers. Commercial driver's license is where you drive larger vehicles or you drive vehicles to make money from. So it's commercial as opposed to like, they don't call it a residential driver's license, but for us who just transport ourselves and our families and friends back and forth, you don't need a CDL. But if you're transporting people for money, you need a commercial driver's license. So that's an exciting program that we have. And you said our top five. And then, our high school equivalency is big too, because there's a tremendous need for a lot of individuals in Buffalo and the surrounding area to attain their high school equivalency, formerly known as GED. That's the more common phrase, but HSE high school equivalency is one of our bigger programs too.
Oh, great. And I'm also going to just throw in there that you do have a security guard program, because I can't think of any place that does not have almost a minimum of 2 security guards.
That's a great question, Francesca. Thank you. Yes, we do offer security guard training. We've just expanded our program. For a while, we only offered the initial 8-hour. Now we offer the 16-hour training that's on the job training. So yes, security guard is a growing industry in Buffalo and in Western New York. And again, to backtrack a little bit so people have a full understanding, our allied health, our registered medical assistant, our medical billing and coding, and our central sterilization technician, those are all nationally accredited certifications. So those certifications can be taken around the continental United States. Our commercial driver's license is only for New York State.
Okay. Now, with that, and that's another question. So if I'm so going through like the top 3 that you mentioned: registered medical assistant, medical billing and coding, central sterilization, and you said it. So there's a certification exam that you take at the end of each program, correct?
Yes, there is, and that's totally paid for by the Educational Opportunity Center. We pay for the classes, we pay for the books, we pay for the scrubs that the 2 cohorts need, and then we also pay for the certifications. So this is a 100% tuition-free program.
Oh, well, that's excellent. So my next question, can you get more than one certification? So can you get the essential sterilization technician and start working at one of the hospitals and think and say, you know what, that, I really wasn't ready. I wasn't mentally prepared for all the studying that goes into the medical billing and coding. Can I call EOC and re-enroll and receive a certification in that, or re-enroll and receive a certification as a registered medical assistant?
Wow, Fred, you're really backing me into a corner right now. Our governing body, UConn, has the intention that we offer services to a diverse and wide variety population of people. In normal circumstances, for our allied health program, they do really only want us to make sure that we're giving access to others. And because these classes fill up a lot, so usually in the pre-enrollment process, we really try to give all of the information. We have allied health information sessions, because although I won't say it's impossible, but because we want to make sure that there's seating in class for other individuals in need, we kind of direct them into a different path.
Well, really, and I think what you're trying to say is that after you receive your certificate from this very warm and friendly EOC environment, because I have to admit, listeners, it has always been a warm and friendly environment, almost like you're walking through your house, walking through your apartment. It's very warm and friendly. But the whole idea is that they want you to go from there once you pass. They help with the job, right? Help place people, and that's the idea.
Yeah, and that's exactly the idea, Fran, and thank you for that. Our goal is to educate the students, assist them with getting the certification, and then job placement, because we want to make sure, that they are able to go out into the work world and begin to use these new skills that they've obtained.
Yes, and then grow, and then grow once they're in their new position at that organization. And many of the hospitals, I know Kaleida does, offers has programs that you can go and receive additional training for that job, building on that, or other areas in healthcare. Again, but that's another area. But you just want people you encourage them to take their wings and find employment. You talked about admissions? What are the requirements? How old? First of all, the age. What's the age? And then what are the requirements?
So we have guidelines, again, sent down from our governing body. First of all, for our high school equivalency, our GED program, you have to be 17 years or older. But there's a couple of caveats with that, because you're still under the guidance of the Buffalo Public School System or whatever suburban school system you might be in. But after that, for our programming, so let me start with the only requirement we have to enroll in our HSE program is that they have a New York State identification. That's number one. That's probably our easiest program to get into, because you're working towards the high school diploma. When you talk about our programming, such as allied health and other programs that we offer here, there are income guidelines. Again, our governing body has set this up to try to bring people from below the poverty line to above the poverty line. So we want to make sure that people who access our services first, because they're tuition free, are financially in need of them. So there are income eligibility guidelines. We also require a high school diploma or a GED to be in our programming. And again, if someone out there has a desire to be in allied health and they do not have their high school diploma, we can help them get the high school diploma to get into the allied health program. And then there's residency. They just have to be residents of New York State.
Okay. And if someone is listening right now, it's Saturday, what should they call and leave a message or go online? Or if they're interested in learning more, what should they do right now at 7:30 in the morning?
At 7:30 in the morning on a Saturday, you could call 716-645-1900. We won't be there at 7:30 in the morning on a Saturday morning, but you can call us and leave a message. And we have an excellent admissions teams that will contact inquiries within 24 to 48 hours. You can also visit us on the web at buffalo.edu/EOC. That's BUFFALO.edu as in education /EOC. On our webpage, you'll find all of our program listings, all of our admissions guidelines, and start the application process. I know even in 2024, a lot of people are hesitant to do online stuff. You can always stop down to 555 Ellicott, Monday through Friday from 9 to 5. There's always an admissions person on site that'll be willing to talk to you, go over programming with you, and give you the information that you need to be successful in your future ventures.
And I have to also add to that you know, I'm new. I'm relatively new now in the workforce development side, but for years at Kaleida, working on the health education side, that you also surprise. Matter of fact, this is going to lead to the next question. I know that you also have many times you have job fairs, wellness fairs, different support services for the students right there. And I'm just talking about that as one. And Lynette, what are some of the other types of support services, tutoring, job placement, interviews? Could you talk about that?
Yes, so the career office, we provide planning and placement services for the students. So we'll assist with resume and cover letter creation, even just updating what you already have, interview preparation, mock interviews. My office will also assist with making connections to employers as well. In some cases, we will have interviews here on site. We've had even Kaleida has come and interviewed the students here. So we really the career services office is here to really assist them and try to remove some of the barriers away from the students in regards to employment.
Mm-hmm. Yeah. How about alumni? Do you offer the same students to alumni?
We do. So alumni are able to receive those services for the rest of their life once they complete a program at the EOC. We have an alumni services office that works with those students and also works with connecting them back to the center. So sometimes we'll have alumni come in and even volunteer at our events, speak in the classroom to other students who have, just really to share what their experience was at the EOC and then what they're doing now.
Mm-hmm. How about if a student is interested in going from EOC to a local 2 or 4 year school, such as Buffalo State, now it's Buffalo University, Buffalo University or the University of Buffalo? Are you able to help them with getting, if they want to continue their education at a 4 year institution? Are you able to help them in that area?
We are. We have a community and college connections office, and this office works with students, alumni, but also anyone in the community. So you do not have to qualify for EOC services to receive assistance from that office. And there they will help students and individuals with completing applications for college, with financial aid, with just even, some career and goal setting and helping them. That office also does college tours. So they will take students, to local colleges to tour those campuses.
Well, I didn't know you did. I thought I knew everything about EOC. I think that you did. After this call, I have an email for you for someone, a high school group for the summer. Do you do college tours during the summer for students?
We do. So our offices are open 12 months. 12 months.
Okay. Oh, all right. All right. Well, I thought I knew everything about EOC.
Well, Fran, just to add to that, because Lynette gave an excellent explanation, it's important. We view ourselves at the EOC as a step in a staircase. We understand the importance of making connections. So Lynette and I and Oliver who is our college preparedness supervisor, we actually reach out to 2- and 4-year colleges and try to do coordinated programming. We have an excellent articulation agreement with the EOP program at Trocaire College. We have articulation agreements with Erie Community College, and underneath the leadership of their new president, Dr. Audion Sagai, and our new executive director, Ben Hilligas, they've made it a priority to show a pathway for individuals from the EOC to higher education.
Yeah, and I have to say that would make total sense because all the programs were all formed under the leadership when Arthur O'Eve was assembly person in Albany.
Yes.
So that, yeah, okay, so that makes perfect sense. That's great. I have a question, and Larry, I think it might be for you. So if someone already has their central sterilization technician certificate from another entity, from one of the local colleges, and they want to go into medical billing, if they already have the degree, their certification from another institution, can they then go to EOC, sign up at EOC for medical billing?
So let me unpack that, because you said a couple
Okay.
of things in that. So we do, you can go to other institutions and receive certification, because colleges, local universities and colleges and 2-year schools are seeing the workforce development trend that's going on that we've been so successful with. So if you have a certification from another institution, you can still apply for certification here at the EOC. So the example you gave, there are some other entities that we won't advertise for that offer central sterilization. But Fran, the great thing about us is we're totally tuition free. Other workforce developments, some of them, there's a fee to take their programming there. So you could take programming here for totally free, whereas in other workforce development institutions, you can't. The second portion of that is we're very meticulous in people who come to us who have previous college credits. You can have up to 32 college credits and still apply for admissions here at the EOC. And then if you have more than 32, then we have to see, when did you actually get that degree? Because a lot of people, they get that mixed up between certification and degrees. Degrees are college credit bearing classes. Mm-hmm. And certifications, in some instances, there are some college credits that are available within certifications, but certifications are more direct access to employment, where we're teaching a curriculum based on the hiring of an individual in a specific job. So again, our admissions advisors are very qualified to be able to help sort out some of those things. But yes, if you have gotten certification from another institution, you're still eligible to come and participate in one of our programs as long as you meet the admissions guidelines.
Right, and I was just going to say, and it could be that at one point in time, your income was higher, and then you do, let's say you're currently a central sterilization tech, and now your income is such that you do meet the EOC guidelines, because I just want our listeners to remember that it is income-based, correct, Lynette and Larry?
Yes. Except for our high school equivalency program.
Yes, that's correct.
Okay. So you don't have to show income for that. And English as a second language, you also offer that as well, right?
We do, and I apologize that it kind of caught me off guard when you said give me the top 5 programs. Actually,
yeah, no. Yeah, I just want to make sure everyone has a breath of what's going on.
Right. So English as a second language is very big right now, and we've just expanded If I could just take a minute or so to talk about our program a little bit more in depth. We've just expanded our English as a second language program to give evening offerings. For quite some time, we've only offered that class or those classes during the day. Now, underneath the direction of our new executive director, now we have evening offerings of our ESL classes because we realize that a lot of people, even though they might need English, they also have jobs during the day. So beginning on January 16th, we're offering English as a second language instruction in the evening. So if there's any listeners out there and you know anybody who's looking, or you yourself are looking for English as a second language, and you say, because most programs do it during the day. So, insight into that and foresight to the needs of the community. Now we have a robust English as a second language instruction that happens both day and evening. And we're working on weekends very soon.
Okay. And I know we only have a few minutes left. So is there anything else that I haven't? We have about 2 minutes left. So is there anything else that you would like to add in a minute that I have, and we literally have a minute that I haven't covered?
30 seconds, and then I'll give Lynette the other minute and 27 seconds. Okay, so we also have a new initiative for our high school equivalency program called Concept 4. The GED test is broken down into 4 components, and a lot of people don't realize this. So what we did is we made this cycle very easy. So of the 4 components you have to pass to get your GED, we do concentrated instruction through curriculum content. So you go through one area, and then immediately on site here, you take the test for that area. So you learn for it, and then you're tested for it all at the same time. And instead of people trying to do all 4 components at once, which causes some frustration, now they could do one component at a time. It is a model that we borrowed from the Manhattan EOC, and we hope to see that it works for our Western New York community here.
Okay, Lynette, your 30 seconds.
I would just like to thank you for having us here, Francesca, just to talk about the opportunities at the EOC, and then remind listeners that they can reach us at 716-645-1900, or take a look at our website at buffalo.edu/EOC.
And on that note, Lynette, you said you've never done this before. I think you've done this before. I want to thank Lynette Towns and Larry Donaldson, both from UB-EOC, where we're talking about tying education, free education, into careers at Kaleida Health or any of our hospitals or medical environments. So thank you so much, Lynette. Thank you so much, Larry, for being our guest this morning on the Great Lakes Health radio program. And next week, you'll hear from my esteemed colleague from ECMC, and that is Cindy Bass. And God be willing, in 2 weeks, you'll hear my voice, Francesca Messiah, Kaleida Health Manager, Workforce Development. Be safe. Bye-bye.